Our lecture today is liver disease in pregnancy. As we say, jaundice in pregnancy can be due to either disease related to pregnancy or disease coincident with pregnancy. Disease related to pregnancy: hyperemesis gravidarum, intrahepatic cholestasis, acute fatty liver, HELLP syndrome. While disease coincident with pregnancy تتزامن مع فترة الحمل: hepatitis, fulminant hepatic failure, and liver cirrhosis. What are the normal physiological changes in laboratory tests during pregnancy? There are some tests will be no change in value, like transaminase enzyme اللي هي aspirate and alanine, bilirubin, prothrombin, also fifth nucleotidase and transpeptidase. دول ما راح يكون بهم change when during pregnancy، لكن اللي يقل عندنا الليفل مالته اللي هو الالبومين وايضا الهيموغلوبين، واللي يزداد اللي هو الكالين فوسفاتيز and alpha fetoprotein. These are normal physiological changes in laboratory test. قسم من الفاكتور ما راح يكون بها change like transaminase, bilirubin, prothrombin, also fifth nucleotidase and transpeptidase, while alpha fetoprotein and alkaline phosphatase will be increased. Albumin decrease, hemoglobin decrease. We are talking about the disease related to pregnancy. We start with hyperemesis gravidarum. It is a persistent vomiting associated with loss of 5% or more of pre-pregnancy body weight. Then persistent vomiting associated with loss of weight, dehydration, ketosis. Also, the hyperemesis gravidarum is uncommon, occurs in first trimester and typically resolved by 20 weeks of gestation. للأسبوع العشرين من الحمل ويصير resolving to this condition. عادة incidence of 0.3 to 2% of pregnancy. What are the risk factors will be encourage the hyperemesis gravidarum? Molar pregnancy, multiple pregnancy, previous history of same condition, and fetal abnormalities like triploidy, trisomy 21, and hydrops fetalis. Liver test abnormalities are common. هنا بالهايبراميسيس جرافيدارم liver test هنا are common، لكن اللي يصير عندنا هنا الجوندس is uncommon. And these changes in liver test will be resolved when the vomiting stop. وإحنا عادة قلنا the condition will be resolved by 20 weeks of gestation. In all, 50 to 60% of hospitalized women with hyperemesis will have a mild elevation in aminotransferase levels, although aspirate and alanine transaminase levels more than 20 times the upper limit of normal rarely will be reported. Then, hyperemesis gravidarum is persistent vomiting associated with loss body weight of mother, dehydration, ketosis, changes in liver test. Jaundice is uncommon and usually occurs at early first trimester, but typically resolved by 20 weeks of gestation. Liver test abnormalities will be common, but resolve when the vomiting is stopped. Risk factor will predispose to hyperemesis gravidarum, molar pregnancy, multiple gestation, fetal abnormalities, and previous history of the same condition. Women with hyperemesis gravidarum will have increased rate of low birth weight, small for gestational age, preterm birth, and poor 5-minute Apgar score. Management supportive, and however, given the risk for electrolyte abnormalities, dehydration, so hospitalization is not frequent إلا إذا صار عندنا electrolyte abnormalities واحتاجين بها hospitalization. Okay, we are repeat to give some questions about these slides. Our lecture today is liver disease in pregnancy. Jaundice in pregnancy may be related to pregnancy or may be coincident with pregnancy. Related to pregnancy, hyperemesis, and we're talking about the hyperemesis. Hyperemesis gravidarum is persistent vomiting. The incidence is uncommon, usually about 3 to 2% of pregnancies. This hypervomiting will be happening at first trimester and typically will be resolved by 20 weeks of gestation. Liver test abnormalities will be happen at hyperemesis gravidarum, but resolve and return to normal when vomiting is stopped. Jaundice is uncommon, and the most important risk factor, molar pregnancy, fetal abnormalities, and previous history of same condition, also multiple pregnancies. These are important point about the hyperemesis gravidarum. What are the normal physiological changes? What are the normal physiological changes will be happen during pregnancy? As we said, these are transaminase, bilirubin, prothrombin, 5th nucleotidase, and transpeptidase. There is no change. Hemoglobin, albumin decrease, alkaline phosphatase, alpha fetoprotein will be increase. The other disease will be related to pregnancy and may be caused jaundice is intrahepatic cholestasis of pregnancy. Intrahepatic cholestasis of pregnancy. Incidence of 0.3 to 5.6%, while hyperemesis of 0.3 to 2%, لكن هناك to 5.6%. Most common liver disease in pregnancy. What are the risk factors? Advanced maternal age, history of the same condition secondary to oral contraceptive, or family or personal history of same condition, and suggestive to this condition will be happen in patient with hepatitis C or cholestasis and non-alcoholic fatty liver disease. Evaluation for alternative etiology should be done if cholestasis fails to resolve after delivery. نعيدها نقول هنا disease related to pregnancy will be caused jaundice. تكلمنا عن الهايبرإمسيس. Incidence of hyperemesis of 0.3 to 2%, while the incidence of intrahepatic cholestasis of 0.3 to 5.6%. Risk factor predisposing for hyperemesis, molar pregnancy, multiple gestation, previous history of the same condition, and fetal abnormalities. Risk factor for intrahepatic cholestasis of pregnancy, advanced maternal age, history of cholestasis secondary oral contraceptive, personal or family history of same condition, or the patient had hepatitis C, non-alcoholic fatty liver disease. Clinical features of acute intrahepatic cholestasis of pregnancy. Pruritus, persistence pruritus. لكن بالهايبرإمسيس قلنا persistence vomiting. هنا persistence pruritus. Typically البالمز and soles باطن القدم وباطن اليد راح تكون هنا, as well as the rest of the body, and resolved with delivery. لكن بالنسبة للهايبرإمسيس قلنا persistence vomiting will be resolved by 20 weeks of gestation. هنا persistence pruritus will be typically involve palms and soles as well as rest of the body and resolve with delivery. Jaundice less than 25%. Always occur after onset of pruritus, while congenital jaundice in hyperemesis is rare, uncommon, now 25%. Fat malabsorption. Maternal outcome is excellent. هنا maternal outcomes is excellent in this cases. يعني ما عندنا نتائج متعبة للمدى. ما يصير عندها الكترولايت ديستربنس أو غير، لكن هنا اللي يصير عندنا ريسك للفيتال ديستريس، ريسك يصير بريتيرم ليبر، بريماتشورتي، انترايوتراين ديث، مثل ما تحدثنا عن إن الريسك بالهايبر إميسيس إنه أيضا راح يكون ممكن بريتيرم سمول جيستيشنال ايج. هنا هم نفس الشيء ممكن يصير بريتيرم ليبر، بريماتشورتي، انترايوتراين ديث، اند فيتال ديستريس. early delivery at 37 weeks is encouraged. نشجع الولادة اللي راح تكون في بداية التاسع بال37 أسبوع، من فقط إنه يصير تيرم فنشجع إنه يصير الدليفري، لأنه ممكن هنا الكومبليكيشن اللي يصير IUD intrauterine death is more common in last month of pregnancy and few death will be occur before 37 weeks of gestation. We are, repeat, intrahepatic cholestasis of pregnancy. Incidence of 0.3 to 5.6%. Risk factor, advanced maternal age. History of condition secondary to oral contraceptive. Family or previous history. And there is higher prevalence in patients with hepatitis C or non-alcoholic fatty liver disease. Evaluation for alternative etiology should be done if cholestasis will be resolved, fail to resolve. Clinical feature, pruritus will be resolved with delivery, jaundice less than 25%, fat malabsorption. Outcome for maternal is excellent, while the fetus risk of fetal distress, preterm birth, prematurity IUD. Encourage of delivery at 37 weeks. Why? Because IUD is more common in last month of pregnancy and a few deaths before 37 weeks of gestation. What are the investigations important for intrahepatic cholestasis in pregnancy? Bile salt concentration, bilirubin, liver enzyme, ultrasonography. Bile salt will be increased, bilirubin increased, liver enzyme will be changed, also increased, and ultrasonography to exclude cholelithiasis. إذا هسه البايل سولت increased bilirubin liver اللي هو راح يكون normally will be decreased as normal physiological، لكن هنا راح يصير بزيادة. liver enzyme قلنا physiological changes no change اللي هي alanine واسبريت، لكن هنا راح يصير بها elevation. ultrasound to exclude cholelithiasis and the bile salt will be increased. Usually bile salt will be associated with fetal distress. If increase more than 40 millimole per liter, more complication. أكثر complication لما البايل salt level will be increased more than 40, while the bile acid concentration is more than 10. So that increase with increased cholic and deoxycholic acid levels. Treatment, also deoxycholic acid, antihistamine, emolinate, vitamin K will be given to women after 36, while to neonate after delivery of 0.1 milligram IM. Serial liver function monitoring and delivery, as we say, 37 weeks because of the risk of intrauterine death. Treatment, urodeoxy will be given. Urodeoxy 10 to 15 milligram per kg. Women weight. Antihistamine because of pruritus. Emolinate اللي هو إكليم مرطب للجسم. Vitamin K to women and to the baby. Baby neonate after delivery, dose of 0.1 milligram per kg, while to women will be given after 36 weeks. Delivery must be at 37 weeks of gestation, and there is serial liver function monitoring. Serial liver function monitoring. Answer with the true or false for the following statement. Hyperemesis gravidarum and HELLP syndrome are diseased cause jaundice in pregnancy. And this disease is related to pregnancy, not coincident. Is it true or false? True. Hyperemesis وHELLP syndrome راح يصير هذا فقط فترة البريجنسي، ما راح يصير هنا coincident with a pregnancy. Not coincident with a pregnancy. Normal physiological changes, decrease level of alpha fetoprotein and decrease level of alkaline phosphatase. False. اللي decrease فقط البيليروبين والهيموغلوبين. decrease فقط الالبومين والهيموغلوبين. Fifth, nucleotidase and prothrombin, no change during the pregnancy. These are considered as normal physiological changes in laboratory tests.
True.
Hyperemesis gravidarum will be happen in first trimester and typically resolve by 25 weeks of gestation.
False.
True.
Hyperemesis gravidarum happen in first trimester. صحيح. And typically resolve by 25 weeks of gestation.
False. 20 weeks.
للأسبوع العشرين. 20 weeks of gestation, not 25. Okay? 20 weeks of gestation. Liver test abnormalities are common with hyperemesis gravidarum, while jaundice is uncommon.
True.
liver test abnormalities صحيح راح تكون common هذه الابنورماليتيز بالتيست فقط، لكن جوندس ما يصير عندها المريضه، يصير لكنه uncommon، لكن الكومن اللي يصير عندنا هو الليفر تيست changes. Yes. Advanced maternal age and patient with hepatitis C, these are considered as risk factor for increased chance of intrahepatic cholestasis during pregnancy. True. Advanced maternal age and hepatitis C إذا المريضة عندها فهي راح يكون أكثر chance علما للintrahepatic cholestasis of pregnancy. Intrahepatic cholestasis of pregnancy will be occur about 0.3 to 5.6%, and it is the rare liver disease in pregnancy. Incidence of 0.3 to 5.6% intrahepatic cholestasis, and it is rare liver disease. نعتبره rare هذا الانسيدنس مالته توصل ل 5.6%. False. It is the most common. It is the most common liver disease during pregnancy. Yes. Persistent vomiting is a clinical feature of hyperemesis, while persistent pruritus is a clinical feature of intrahepatic cholestasis during pregnancy. True. بالهايبريميسيس ايش راح يصير عندنا persistent vomiting، لكن هذا intrahepatic cholestasis شو يصير عندهم persistent pruritus. There is risk of preterm labor due to hyperemesis and intrahepatic cholestasis during pregnancy. اكو chance يصير preterm labor بالكونديشن اثنينهم، بالهايبريميسيس وبالانتراهيباتيك. Preterm labor is considered as complication of and intrahepatic cholestasis during pregnancy. True or false?
True.
الاوتكم مالت الفيتس شو يصير عندهم؟ يعني هل هو له سايد افكت الهايبر اميسيس جرافيدارم على الفيتس؟ الانتراهيباتيك كوليستيسيس له سايد افكت على الفيتس، صحيح له سايد افكت، راح يصيرون فيتال ديستريس، بريتيرم ليبر، ممكن يصير small for gestational age بالهايبريميسيس gravidarum. Yes. Intrahepatic cholestasis during pregnancy, there is decrease in bile salt while increase in bilirubin levels. False. راح يصير عندنا زيادة بالبايل سولت، زيادة بالبيليروبين. ليفر انزيم ايضا زياده راح يصير بها، والانفستيجيشن الرابعه اللي نسويه للمريضه هي الالتراسونوجراف. Treatment of intrahepatic cholestasis during pregnancy is delivery at 37 weeks of gestation, one of the important point in management of this case. delivery نفضلها تكون بال 37 weeks. ليش؟ لانه ممكن شيء يصير عندنا هنا يصير intrauterine death بال last month of pregnancy. Vitamin K supplementation to women and to neonate in a case of hyperemesis gravidarum. لازم أنطي للمريضة فيتامين كي اللي هي هايبراميسيس، وأيضا للنونيت بعد الولادة أنطي فيتامين كي. إذا هي المريضة هايبراميسيس لو ويا كيس أنطيها فيتامين كي.
Intrahepatic cholestasis.
Intrahepatic cholestasis. Yes, very good. We are talking about the third cause of diseases related to pregnancy in preeclampsia and eclampsia. What is the definition of preeclampsia? It's characterized by new onset hypertension, systolic more than 140 and diastolic more than 90 or equal to 90 millimeter mercury, plus proteinuria more than 300 milligram for 24 hours after 20 weeks of gestation. This is the preeclampsia. It's characterized by new onset hypertension and proteinuria after 20 weeks of gestation. While eclampsia is present when grand mal Caesar occur. Hepatic involvement also will be present with epigastric or right upper quadrant pain, hepatomegaly stretching, loosen capsule. Liver injury also will be having as a consequence of vasoconstriction and febrile precipitation in the liver, and complications can include hematoma. Then preeclampsia, new onset of hypertension and proteinuria after 20 weeks of gestation, eclampsia, Caesar, grand mal, hepatic involvement, there is epigastric or right upper quadrant pain from hepatomegaly, liver injury as a consequence of vasoconstriction and febrile precipitation in liver. Complication also associated with liver hematoma and rupture. Liver enzyme like aspirate and alanine transaminase will be elevation, can be citric، راح يكون ملفت للنظر الاليفيشن اللي بيه. ايضا هنا الماجنتيود اوف ليفر كيمستري abnormalities parallel راح يكون موازي للريسك اوف ادفيرس ماتيرنال but not fetal outcome. يعني كل ما تكون هنا الابنورماليتيز عاليه بالليفر كيمستري فاكيد راح يكون الاوتكم على الماتيرنال يكون اكثر complication، لكن الفيتال outcome is not affected. Liver test can't exclusively be used to gauge a clinical decision. يعني ما نقدر نقول هنا الليفر تيست صح لها أهمية، كل ما يصير بها abnormality أكثر إذا هي تعطيني أكثر هنا فكرة عن الماتيرنال كومبليكيشن، لكن هي ما راح تكون هي حصريا هي تعتبر المقياس للديسيجن الطبي مالتنا. وفي بعض الأحيان وجود هنا نورمال ليفر انزيم doesn't exclude disease، يعني نسوي لها انفستيجيشن نورمال ما يعني هذا الكيس انه هي ما عندنا فد بري اكلامسيا اللي هي راح نتدخل بالهيلب سيندروم. Delivery is curative treatment after 36 to 37 and there is no advantage in continuing the pregnancy. يعني هنا حالة انه نفضل الدليفري يصيرنا راح يفضل لنا انه waiting for continue delivery البريجنسي. HELLP syndrome. What is the HELLP syndrome? اسمه hemolytic anemia, increased liver enzyme and low platelet. إذا هذه هنا hemolytic anemia, elevated liver enzyme EL and low platelet count LO. Will be affect a minority of pregnancy but complication up to 20% of severe PE. Typically present between 28 and 36 weeks of gestation. 30% will be manifest symptom in first week postpartum. Risk factor: advanced maternal age, nullibar. Then HELLP syndrome, hemolytic anemia, elevated liver enzyme, low platelet. These cases will be happen in minority of cases, but complication up to 20%. Typically will be happen between 28 and 36 weeks of gestation. And maybe symptoms will be manifest in first week postpartum، يعني أول أسبوع فترة النفاس. Risk factor: advanced maternal age, nullibara. The hypertension related liver disease share similar clinical presentation. Differentiation is difficult as there is overlap in these features. راح يصير هنا hypertension related liver disease ممكن تعطيني نفس الكلينيكال برزنتيشن علما للهيلب سيندروم، والديفرنشيشن راح يكون هنا overlap تداخل به. لكن الدايجنوستس هنا راح يكون نتعرف عليه من خلال التيبيكال لابوراتوري تيست اللي هي راح يشوف بي elevated liver enzyme, low platelet and hemolytic anemia. Sign of hemolytic anemia: thrombocytopenia اللي platelet count اللي أقل من 1000, elevation بالliver enzyme, serum bilirubin, lactate dehydrogenase are expected. كل هذه راح تكون متوقعة بالهيلب syndrome. Sign للهيموليتيك anemia, thrombocytopenia, platelet count, elevation liver enzyme, serum bilirubin, lactate dehydrogenase are expected. But there are no pathognomonic clinical signs, and someone with HELLP may be asymptomatic. Clinically, there is right upper quadrant and gastric pain. المريضة نشيك الضغط مالتها راح نشوفه عالي، بروتينوريا، بتنج اوديما ممكن، وراح نجي الفيتشر مالتها تجينا بجاستريك بين. هواي كيسات جاي تشوفوا بجاستريك بين، رايت ابر كوادرنت بين، نيوزيا، فوميتنج، ماليز، هيديك، اوديما اند ويت جين. هذه common complication or symptom will be having with a condition with HELLP syndrome. Hypertension and proteinuria should be expected. قلنا تجينا المريضة ضغط عندها، تجينا المريضة عندها بروتينوري، بعدين تعطينا هذه السبتوم اللي هي الابر كوادرنت بين، الجاستريك بين، هيديك، نيوزيا، فوميتنج. نسوي لها انفستيجيشن، راح نلقي عليها هيموليتيك انيميا، هيموليسيس، نشوف elevated بالليفر انزيم like alanine, asparated transaminase, bilirubin, lactate dehydrogenase, and low platelet thrombocytopenia. This condition will be related to HELLP syndrome. Hypertension and proteinuria should be expected and occurring in up to 80% of cases. Jaundice is rare, occurring in only 5% of patients. Jaundice is rare. Maternal consequences to condition with HELLP syndrome. Mortality rate 1 to 3%. Mortality rate 1 to 3%. And progression can also be rapid, but laboratory value will be typically begin to normalize 48 hours postpartum. خلال أول يومين بعد الولادة ممكن liver test laboratory value will be returned to the normal. Fetal prognosis is linked to gestational age at delivery and birth weight. يعني الفيتس لما هنا تكون الولادة مالته بالبريتيرم أكيد راح تكون complication للبريتيرم labor. لكن لما يكون هنا gestational age of the fetus صار تعدى 37 week، يعني صار term baby good body weight، فراح يكون البروجنوسيس مالته is better. Hepatic consequences, as we say, hepatic infarction, rupture, hemorrhage, hematoma. And hepatic infarction should be suspected with the right upper quadrant vein with fever, whereas abdominal swelling or shock presentation can occur with hepatic rupture. What are the important points in management case for HELLP syndrome? Blood pressure control, termination of a pregnancy, glucose supplementation, platelet transfusion, glucocorticoid is no evidence, but surgery is indicated in case of hematoma or rupture capsule. Surgery is indicated in hematoma or rupture capsule. We are, we're talking about the preeclampsia. As we know, the definition hypertension and proteinuria. Grand mal Caesar occur, eclampsia. There is HELLP, hepatic involvement, hepatic rupture, hematoma. Laboratory test, there is elevation in liver enzyme like aspirin, transaminase, alanine, transaminase, and maybe cases condition with PE, but there is normal liver enzyme. Delivery is important at time of 36 to 37, no advantage in continue the pregnancy. HELLP syndrome is characterized by hemolytic anemia, increased liver enzyme and low platelet, and typically HELLP syndrome will be happen between 28 to 36. جبنا لكم الصورة. طلاب
نعم دكتورة واضح.
واضح؟
نعم.
Hypertension related liver disease share similar clinical presentation and the diagnosis is typically there is laboratory result. Sign of anemia, thrombocytopenia and liver enzyme changes when there is epigastric pain, nausea, vomiting. This is mean with increased blood pressure and proteinuria. This is indicate for the complication, HELLP syndrome and complication related to the liver. Maternal consequences, maternal mortality 1 to 3%, laboratory test normalized 48 hours postpartum, maybe hepatic infarction, hemorrhage suspected with upper quadrant pain and with fever. Management, controlling the blood pressure, termination of the pregnancy, the glucose supplement, platelet transfusion, surgery indicated if there is hematoma or rupture capsule. Answer with a true or false for the following statement. Preeclampsia is characterized by increased blood pressure and proteinuria after 30 weeks of gestation. Preeclampsia is characterized by new onset hyperproteinuria after 30 weeks of gestation.
False.
After 20 weeks of gestation, yes. HELLP syndrome is characterized by hemolytic anemia, elevated liver enzyme, and elevated platelet count.
False.
False, low platelet count, yes. Risk factor for HELLP syndrome, increased maternal age and grand multivara.
False.
Nullivar.
Nullivar.
Nullivar and advanced maternal age. Yes. Hypertension and proteinuria should be expected in a case with HELLP syndrome. يعني مريضة HELLP syndrome لازم أخلي ببالي إنه متوقع إيش صار عندها hypertension and proteinuria. True or false?
True.
True. HELLP syndrome منين إجاني؟ المريضة أصلاً هي عندها hypertension وبروتينيوريا وصارت complication HELLP syndrome. Okay. Pregnant women with right upper quadrant pain with fever. Pregnant women with right upper quadrant pain with fever.
True.
And shock. لا خلينا ننتظر. Pregnant women with right upper quadrant pain with fever. Also, whereas abdominal swelling or shock presentation can occur with hepatic rupture. يعني المريضة عندها right upper quadrant pain، عندها fever. بنفس الوقت شنو عندنا هنا بين ما شنو عندها abdominal swelling أو عندنا شوك إجت المريضة، فش أتوقعتها happen with hepatic rupture. hepatic rupture أتوقع يصير عندها شوك المريضة لو لا؟ True. hepatic rupture المريضة. Okay. Surgical treatment indicated in patient with hepatic hematoma. Surgical treatment is indicated only in unstable patient with hepatic hematoma. True. Controlling of blood pressure is important point in a case in a condition on a pregnant woman with HELLP syndrome.
True.
نسوي لها كنترول للبلد بريشر لو لا؟
True.
ترو، لان هي اللي راح يصير عندنا HELLP syndrome complication. قلنا لازم المريضة عندها نتوقع hypertension وبروتينوريا. Termination of pregnancy is not indicated in a condition with HELLP syndrome.
False.
False. يعني هل ممكن انه اخليها continue للبريجنسي وهي المريضة HELLP syndrome؟ لابد وهي indication elimination of pregnancy. Okay. The third disease will be related to pregnancy is acute fatty liver disease of pregnancy. Acute fatty liver disease of pregnancy اللي هي مرض الكبد الدهن الحاد ناتج عن الحمل. is rare، لكن اللي قلنا intrahepatic cholestasis قلنا common، لكن هنا شنو rare؟ life threatening condition characterized by microvesicular fatty infiltration of the liver due to deficiency of this enzyme and leading to hepatic failure. The acute fatty liver disease rare life-threatening condition يهدد حياة المريض. ليش؟ لأنه يسوي لنا hepatic failure عجز بالكبد. The median gestational age at the time of identification is 36 weeks of gestation. Acute fatty liver disease of pregnancy is rare, life-threatening condition leading to hepatic failure. Median gestational age at time of identification is 36 weeks of gestation. What are the risk factors for acute fatty liver disease? Multiple gestation, low body mass index, male sex pregnancy إذا الأم حامل male, previous history of same condition. Mortality rate 12.5 to 18% and neonatal mortality reach 50%. إذن acute fatty liver disease هي rare condition لكن تعتبر life threatening. Maternal mortality 12.5 to 18%. تعتبر risky for the fetus because neonatal mortality reach 50%. Risk factor multiple gestation, low body mass index, and if pregnant women with male sex and history of same condition. What is the median gestational age for acute fatty liver disease? Is the time of identification at 36 weeks of gestation. 36 weeks of gestation. This condition will be leading characterized by microvesicular fatty infiltration of liver and leading to hepatic failure. Acute fatty liver disease of pregnancy rare, life-threatening, leading to hepatic failure. Gestational age 36 weeks, multiple gestation and low body mass index and male sex pregnancy and the previous history of same condition are risk factor for acute fatty liver. Mortality rate 12.5 to 18%. Neonatal mortality reach 50%. What are the clinical features for this condition? Clinical features. Presenting symptoms are non-specific. Nausea, vomiting, abdominal pain. Concomitant preeclampsia is present in roughly 1/2 of the affected women. And there is hepatic failure and hepatic dysfunction, sign of hepatic dysfunction like encephalopathy, or there is hypoglycemia and coagulopathy. Also, renal function and pancreatitis are common. Acute fatty liver disease of pregnancy is rare, life-threatening, leading to hepatic failure. Median gestational age 36. Risk factor twin, low body mass index, male sex pregnancy, previous history of condition. Maternal mortality rate 12.5 to 18, while neonatal mortality rate reach 50%. Presenting symptom, nausea, vomiting, abdominal pain, and there is sign of hepatic dysfunction such as encephalopathy, hypoglycemic coagulopathy. Pancreatitis and renal function are common. What are the criteria important for diagnosis of acute fatty liver disease? Must be present of, as we say, vomiting, abdominal pain, polydipsia, polyuria, encephalopathy, elevated bilirubin, hypoglycemia, elevated urea, leukocytosis, and ascites or bright liver on ultrasound, elevated transaminase, elevated ammonia, renal impairment, coagulopathy, and microvesicular stenosis on liver biopsy. What is the important point at treatment? Must be early recognition. من البداية راح نتعرف على الديزيز. Promote delivery and supportive care is important. Also, fetal and maternal prognosis will be included. كل ما يصير correction للهايبوغلايسيميا، كل ما early detection, early management, prognosis will become better. And the postpartum clinical course also is dependent on interval between symptom and termination of pregnancy. If hepatic function doesn't rapidly improve, evaluation for liver transplantation. إذا ما صار عندنا تحسن بالحالة ممكن يصير liver transplantation. offers the patient the best chance for survival لأنه المورتاليتي rate عالية. What are the disorders will be coincident to pregnancy as we say hepatitis, the viral hepatitis, and we say liver cirrhosis and fulminant hepatic failure. Hepatitis A, B, D, C, E. And clinical features, sign, symptom, and complication will be identical in pregnant and non-pregnant female. يكون متشابه للحامل وغير الحامل. بالنسبة للأي abrupt onset راح يكون هنا onset اللي عندنا abrupt، while C, B, D prolonged onset. مفاجئ راح يكون للهيباتيتس A، لكن B, C, D prolonged. And there is nausea, vomiting, abdominal pain before will be before jaundice, anorexia, malaise, dark urine, hepatomegaly, fever. The nausea, vomiting, abdominal pain, fever هنا راح يكون hepatomegaly، إذا يكون jaundice. Investigation will be increased serum transaminase with or without total serum albumin. Increase بالadenine transaminase indicate acute hepatic. There is hepatitis and hepatitis A which E, IgM, either increase. Hepatitis E, AG, and hepatitis A antibody. Moderate increase alkaline phosphatase. Leukocyte normal. Prothrombin time with thrombocytopenia prolonged. Renal function will be normal. Clinical and biochemical recovery will be take 1 to 2 months. Then the investigation will be done to hepatitis. Liver enzyme transaminase, adenine transaminase، هنا increase transaminase وزيادة بالadenine معناها acute hepatic injury. Hepatitis A و E IgM, hepatitis E antigen, hepatitis A antibody. Increase بالalkaline phosphatase، أيضا leukocyte راح يكون normal. Prolonged prothrombin time, thrombocytopenia. Renal function normal, and these changes will be recovery take 1 to 2 months. Take of these will take 1 to 2 months. We talk about the hepatitis B and hepatitis C. Hepatitis B course is not related by pregnancy in a coincident here. Hepatitis B may lead to hepatic failure, preterm labor, fetal-maternal transmission will be occur. إذا course is not altered by pregnancy. Maybe it lead to acute hepatic failure, preterm labor, and the transmission fetal-maternal will be happen with hepatitis B. What are the routes of transmission? Transplacental, vertical transmission, breastfeeding, and salivary contamination. In salivary contamination, breastfeeding, and vertical transmission during labor, contamination amniotic fluid, and the transplacental. How can we prevent the neonatal infection of hepatitis B؟ يعني الأم ندري عندها hepatitis B والنيونيت راح يصير لها تيفر، فشلون هنا راح يسوي لي prevention؟ Serological screening for all pregnancy offered at their antenatal booking visit. Intrafetal scalp electrode and there is fetal blood sampling should be avoided. Forceps will be used rather than ventouse. إذا احتاجنا instrumental delivery نستخدم الفورسبس أكثر من الفنتوز. Keep the membrane intact حتى لا يصير transmission as long as possible. Administer hepatitis B immunoglobulin to those neonates born to high inactivity 1. هذا the prevention of neonatal infection of hepatitis B. Serological screening of all pregnancy. Fetal scalp electrode and fetal blood sampling should be avoided. Using forceps rather than ventouse. Keep the membrane intact. Administer hepatitis B immunoglobulin to those neonates born to high inactivity mother. Hepatitis C is the same as hepatitis B. but with screening for hepatitis C is not offered routinely in the neonatal care. ما دائما نسوي الهيباتيتس C not routinely will be done in antenatal care. Breastfeeding doesn't appear to risk of mother to child transmission. شافوا ان البريست فيدنج مو كل شيء هنا هو الطريق اللي راح ينقل لنا الهيباتيتس C. Okay, we're talking about the biliary disease in pregnancy. Biliary disease in pregnancy. Cholestasis is common in pregnancy. This is due to increase in level of estrogen, will lead to or causing cholesterol supersaturation and increased cholesterol. إذا في البرجنسي ليش يصير الشانس للكوليسترول أعلى؟ بسبب زيادة الاستروجين ليفل، وهذا متوقع during the pregnancy. بعدها راح يصير كوليسترول سوبر ساتوريشن. بعدها راح يصير عندنا هنا increase the chance of cholesterol. The incidence of cholestasis and cholelithiasis in a pregnant woman is 3.5%. Management is conservative and surgical treatment in severe cases. Management is conservative and surgical treatment in severe cases. We are talking about this disease will be related to pregnancy, like Hyperemesis gravidarum, HELLP syndrome, acute intrahepatic cholestasis during pregnancy, and talking about preeclampsia and complication is HELLP syndrome. Then we talk about the acute fatty liver disease in pregnancy. While the disorder coincident to a pregnancy is hepatitis and fulminant hepatic failure and liver cirrhosis. We're talking about the hepatitis and the types of hepatitis A, B, C, D, E. The onset will be differ according to type. Hepatitis A abrupt onset راح تكون بداية مفاجئة. Hepatitis B, C, D, E راح تكون prolonged onset. And there is jaundice, anorexia, malaise, hepatomegaly, and other. Investigation will be done laboratory test for liver like serum transaminase, liver enzymes, alanine transaminase, anti-hepatitis A and B IgM, hepatitis A IgG and hepatitis C, that's antibody, increased alkaline phosphatase, leukocyte, and other renal function test and other tests. Hepatitis B, the course is not altered during the pregnancy, may lead to hepatic failure, preterm labor, fetal-maternal transmission will be happen with hepatitis B. What are the routes for transmission? Maybe transplacental, vertical transmission, breastfeeding, and salivary contamination. Prevention by serological screening, keep the membrane intact, administer immunoglobulin for neonate born to high inactivity mother, and there is contraindication or usage of forceps rather than using of phantoms. Hepatitis C is the same as B, but with screening for hepatitis C is not affected, offered routinely in the antenatal care. Biliary disease in pregnancy common due to increased estrogen level, causing cholesterol supersaturation and later on lead to gallstone formation. Incidence is 3.5%. Management may be conservative or surgical in severe cases. Answer with the true or false for the following statement. Answer with the true or false for the following statement. Twin pregnancy considered as risk factor for Hyperemesis gravidarum, acute fatty liver disease of pregnancy.
True.
True. twin pregnancy جاي نشوف وين ما راح هنا نجينا كيس جاي نلاقي هي واحد من risk factor for this condition. Yes. Clinical feature of hepatitis A is abrupt onset, while hepatitis B, C, D is a prolonged onset.
True.
True. onset اختلفت عنا. بالA كانت abrupt onset، لكن بالB والC والD كانت هنا prolonged onset. Transplacental and salivary contamination and through breastfeeding is considered are routes of transmission of hepatitis A.
False.
False.
False. يا hepatitis B. hepatitis B هي هذا route of transmission. Yes. Serological screening of all pregnancies is routinely offered for hepatitis B, while is not routinely offered for hepatitis C.
True.
True. فقط البي يعتبر هنا offered routinely، لكن السي not routinely will be offered at antenatal visit. Increased progesterone level during the pregnancy will be increased chance of gallstone formation.
False. Estrogen.
Estrogen, yes. Management of biliary disease in a pregnancy may be conservative and may be surgical in mild cases.
False. Severe cases.
In severe cases, false. In severe cases. Yes, very good. عندنا سؤال. شكرا جزيلا.